The human heart is susceptible to various diseases and conditions that can affect its structure, function, and overall health. Let's understand common diseases and conditions of the human heart in this video. Coronary artery disease. Coronary artery disease occurs when the coronary arteries, which supply oxygen-rich blood to the heart muscle, become narrowed or blocked by plaque buildup, atherosclerosis. Symptoms may include chest pain or discomfort, angina, shortness of breath, fatigue, and in severe cases, heart attack, myocardial infarction. Heart attack, myocardial infarction. A heart attack occurs when blood flow to a part of the heart muscle is blocked, leading to tissue damage or death. Symptoms may include chest pain or discomfort, pain radiating to the arm, jaw, or back, shortness of breath, nausea, and sweating. Heart failure. Heart failure occurs when the heart is unable to pump enough blood to meet the body's demands, leading to fluid buildup in the lungs and other tissues. Symptoms may include shortness of breath, fatigue, swelling, edema in the legs, ankles, or abdomen, rapid or irregular heartbeat, and persistent coughing or wheezing. Arrhythmias. Arrhythmias are abnormal heart rhythms that may be too fast, tachycardia, too slow, bradycardia, or irregular. Types of arrhythmias include atrial fibrillation, ventricular fibrillation, atrial flutter, and supraventricular tachycardia. Symptoms may include palpitations, dizziness, fainting, chest discomfort, and fatigue. Valvular heart disease. Valvular heart disease occurs when the heart valves, such as the mitral, aortic, tricuspid, or pulmonary valves, are damaged or malfunctioning, leading to valve stenosis, narrowing, or regurgitation, leakage. Symptoms may include shortness of breath, fatigue, chest pain, palpitations, and swelling in the ankles or feet. Hypertension, high blood pressure. Hypertension is a condition characterized by elevated blood pressure levels, which can strain the heart and blood vessels over time. Hypertension is often asymptomatic but can increase the risk of heart disease, stroke, kidney disease, and other complications if left untreated. Cardiomyopathy. Cardiomyopathy refers to diseases of the heart muscle, resulting in abnormal enlargement, thickening, or weakening of the heart muscle. Types of cardiomyopathy include dilated cardiomyopathy, hypertrophic cardiomyopathy, and restrictive cardiomyopathy. Symptoms may include shortness of breath, fatigue, swelling, palpitations, and chest pain. Congenital heart defects. Congenital heart defects are structural abnormalities of the heart present at birth, resulting from abnormal development during fetal growth. Examples of congenital heart defects include atrial septal defect, ventricular septal defect, tetralogy of Fallot, and coarctation of the aorta. Symptoms and severity of congenital heart defects vary widely depending on the specific defect and may require medical intervention. Pericarditis. Pericarditis is inflammation of the pericardium, the double-layered sac surrounding the heart. Symptoms may include chest pain, sharp, stabbing, or dull, fever, fatigue, shortness of breath, and coughing. Endocarditis. Endocarditis is an infection of the inner lining of the heart chambers and valves, typically caused by bacteria or other pathogens entering the bloodstream. Symptoms may include fever, chills, fatigue, muscle aches, night sweats, and changes in heart rhythm. Myocarditis. Myocarditis is inflammation of the myocardium, the muscular layer of the heart. It can be caused by viral infections, bacterial infections, autoimmune diseases, or exposure to certain toxins. Symptoms may include chest pain, shortness of breath, fatigue, fever, palpitations, and swelling in the legs or abdomen. Endocardial cushion defects. Endocardial cushion defects are congenital heart defects characterized by abnormal development of the endocardial cushions during fetal development. These defects can involve abnormalities in the atrial septum, ventricular septum, and atrioventricular valves. Symptoms and severity vary depending on the specific defect and may include shortness of breath, fatigue, poor growth, and cyanosis, bluish discoloration of the skin. Heart valve disorders. Apart from valvular heart disease, other heart valve disorders include mitral valve prolapse, a condition in which the mitral valve bulges into the left atrium during contraction. Bicuspid aortic valve, a congenital condition in which the aortic valve has two cusps instead of three. Aortic stenosis, narrowing of the aortic valve, which obstructs blood flow from the left ventricle to the aorta. These conditions may lead to symptoms such as chest pain, palpitations, shortness of breath, and fatigue. Cardiac tumors. Cardiac tumors can be benign, non-cancerous, or malignant, cancerous, growths that develop in the heart tissue. Primary cardiac tumors originate in the heart, while secondary tumors metastasize from other parts of the body. Symptoms may include chest pain, shortness of breath, palpitations, fatigue, and signs of heart failure. Arrhythmogenic right ventricular dysplasia, ARVD. ARVD is a rare inherited condition characterized by abnormal replacement of heart muscle with fatty or fibrous tissue, primarily affecting the right ventricle. It can lead to arrhythmias, heart failure, and sudden cardiac arrest, especially in young individuals. Symptoms may include palpitations, fainting, chest pain, and shortness of breath. Heart rhythm disorders. Apart from arrhythmias, other heart rhythm disorders include long QT syndrome, a genetic condition characterized by prolonged QT intervals on electrocardiogram, which can lead to arrhythmias and sudden cardiac death. Wolff-Parkinson-White syndrome, a condition in which an extra electrical pathway in the heart leads to episodes of rapid heart rate, supraventricular tachycardia. These disorders may present with symptoms such as palpitations, dizziness, fainting, and chest discomfort. Peripheral artery disease, PAD. Peripheral artery disease is a condition characterized by narrowing or blockage of arteries outside the heart, typically in the legs. Symptoms may include leg pain, cramping, numbness, weakness, and coldness in the lower extremities, especially during exercise. These are the examples of the diseases and conditions that can affect the human heart. Prompt diagnosis, treatment, and management are crucial for individuals with heart disease to prevent complications and improve outcomes. Regular medical checkups, healthy lifestyle choices, and adherence to treatment plans can help reduce the risk of heart disease and promote cardiovascular health.